Today I wanted to talk about radial wrist pain, which is pain on the thumb side of the wrist. There's a lot of different causes for this, but I wanted to focus on Quervain's tenosynovitis. So during this talk I'll introduce what it is, how to recognize it, some orthopedic examination techniques, acupuncture treatment, and some preventative techniques. So first of all, what is Quervain's tenosynovitis? Initially, there may be some itis, inflammation that takes place, but what they're showing through research is that as time progresses, there's more of a degenerative thickening of the tendon and tendon sheath, which creates less space for movement and creates more friction in this area, causing pain and stiffness. So the symptoms are pretty straightforward. The patient will have pain in this region. It may extend down to the back side of the thumb. There may be some stiffness with movement. Occasionally patients will have crepitus, which is like a popping or a clicking sensation in that region. Very rarely a patient may have triggering of the thumb. Literature says something like 1% of patients may have this. I've only seen a couple of patients at the most who've had this, and I treat this regularly. Who gets Quervain's tenosynovitis? It's more common in females, but anybody can get it. And it doesn't matter if you're right-handed or left-handed. It can happen on either side. There's many causes, but the most common cause that you're going to see is from repetitive strain injuries. So doing an activity over and over with improper body mechanics or improper ergonomic setup, for example. So that will be the most common cause that you're going to see, repetitive strain. So what do you want to look for that may look like Quervain's tenosynovitis? There could be arthritis in the area, there could be nerve injuries, there could be tendinitis from other neighboring muscles and tendons. So we'll talk briefly about that during the physical exam. So first thing you want to check is the patient's range of motion. And you want to assume that you've already checked the neck, shoulder, and elbow, and you've worked your way down to the wrist and thumb. So the first motion you want to check will be wrist flexion. So have the patient move their wrist downward, keeping the finger straight, not bent, because that will change the movement. And then next have them extend their wrist. Next, check radial deviation, which is moving the hand towards the thumb side. And then ulnar deviation, which is moving it towards the pinky side. Either one of these can cause pain. Ulnar deviation stretches this region, and radial deviation compresses it. Next, check thumb opposition, which is moving the thumb tip towards the base of the pinky at the distal palmar crease. This movement will commonly cause pain as it stretches the tendons through the radial wrist. You can use this as an objective measurement. You can take a ruler, goniometer, tape measure, whatever you have handy, and you can measure the distance. I usually do this in millimeters, and I use the fingernail as a landmark to see how far the patient can go. You can check this before the treatment and after the treatment, and usually what you'll see is after the session they'll be able to go farther or even touch where they weren't be able to do that prior to the session, and that can be a guide to a successful treatment. There's a couple of different provocative tests or orthopedic tests you can use for Quervain's. The most common that people recognize is Finkelstein's test, also known as Eichhoff's test. So basically the patient grabs their own thumb and ulnar deviates the wrist, which will stress the two tendons in this area, extensor pollicis brevis and abductor pollicis longus. Interesting thing to note is that there's been a good cadaver study showing that the muscle belly tendon unit of extensor pollicis brevis actually moves inside the tendon sheath and expands it when this test is done, which can be the cause of pain in this region. So this may be a good test to rule in extensor pollicis brevis. So with acupuncture, there's a lot of effective treatments for Quervain's. I'm just going to discuss a very simple approach that I use on a regular basis and have consistent results with. So first of all, you have to know the anatomy. So when a person extends their thumb, on me it's easy to see. You'll see some movement here in this depression. That's the extensor pollicis brevis. If you find large intestine 6, it's the exact same location, which is interesting because the name of this point is Pian Li, which is translated in some texts as veering passage. Most of the muscles in the forearm run longitudinally in straight lines, whereas the muscles of de Quervain's, the abductor pollicis longus and extensor pollicis brevis, run at an oblique angle, like a veering passage. So it's kind of easy to remember. So find that area, palpate it, and look for the tight band that reproduces the patient's symptoms of radial wrist pain or dorsal thumb discomfort. So I just insert the needle into the extensor pollicis brevis and I angle it down towards the wrist. If I was going to use a one needle treatment, this would be it, because some studies have shown when a patient has a positive ICHOPS or Finkelstein's test that the extensor pollicis brevis is the one that's the cause. So the muscle belly actually moves inside the tendon sheath, expands the tendon sheath, and can produce discomfort. So in my clinical practice, I usually see this as the main cause, even though the abductor pollicis longus is involved, isolated or in combination. So I put the needle in, and if you look at my thumb, you'll see that there's a jumping of my thumb, which tells you, yeah, I'm on that muscle. When I treat this particular area, I'm not trying to produce a very strong sensation. I'm just trying to reproduce the patient's symptoms, and it's usually with a very superficial technique. Sometimes you'll get a patient that's very stubborn where you need to manipulate the needle a little more. You might need to get a fasciculation in the muscle, but for me, I haven't found that to be the case thus far. So a couple of preventative techniques. So first of all, you want to know what a neutral wrist position is. So in a perfect world, the hand would be in line with the forearm, especially when doing things like keyboarding. You don't want the wrist extended or flexed. Also, when you look at the hand from this position, you would want to line up the middle of the forearm with the third metacarpal or middle finger bone. And if the patient is radial deviating or ulnar deviating, this would also be a possible cause for de Quervain's tenosynovitis. It's really common to see people mousing with their hand ulnar deviated or keyboarding with their hand ulnar deviated, especially if the elbow gets away from the body, which puts that hand into that position. Some other possible causes are lifting in this position. So lifting a baby, brand new mothers, whenever your hand is in this position without any weight, the muscles are contracting to keep it in a neutral position. Otherwise, the hand would just flop down. So just by holding it here, this is contracting. So when you lift and carry weight from this position, it's making this area work even harder. So lifting weights in this position, hammering, etc. So being mindful of the kinesiology and how the body works, you can share this with patients as they're trying to recuperate. Some other causes of pain in this area to be aware of. First one is CMC arthritis, metacarpal arthritis, which would be right in this area here. What you would do is you just grab the first metacarpal and you would press it in this direction, and then you would rotate as you're doing that to basically compress and grind the bones together, which may cause pain if there's arthritis. Also, there could be some nerve irritation here from the superficial radial nerve. They may have a positive Finkelstein's, but they may also have numbness and tingling, which you're looking for with nerve patterns, which is not de Quervain's tenosynovitis. Cervical radiculopathy could also cause numbness and tingling of the thumb and index, or possibly pain in this area. And it's easy to remember, C6 goes to the thumb and index. It looks like a 6. So in summary, de Quervain's tenosynovitis is very common. You're going to see this regularly, and you may even experience it yourself. It's pretty easy to recognize if you're aware of the symptoms, and the physical exam can be pretty straightforward. So hopefully now you have a better understanding of how to recognize this, how to treat it, and more importantly, how to prevent it for yourself and for your patients.